disabilities. This is actually for the youth in this room. This is a hard question. I wonder if those young adults graduating from college that have disabilities are feeling like it was a waste because they're not finding jobs that pay enough to be independent and have to apply for government assistance, or maybe are finding that they cannot work consistently due to health or fatigue issues and end up needing government assistance. Is there anyone who could speak to this? I think we have a few.
I can definitely speak to this. I graduated from Simmons in Boston 3 years ago, and I haven't been employed since. So I see where you're coming from and what you might be thinking, but it's not a waste of time because while it is a long process and it does take 4 years of your life, those who graduate from college do earn more than those who do not. And I mean, the work is hard, I'm not going to lie to you, but you do make a lot of friends, and there are plenty of life experiences that you do gain in college that you wouldn't gain anywhere else.
Thank you, that's all.
And I want to speak to that too. This is Mallory, and number one, I want to thank our listener for that question because I think that is a prime example of what we are here to talk about and what we're trying to do with this. And that's what it's like. You know, those are the things that go on in our heads and the reality of what we are facing as young adults. And we actually talked a lot about this in a session yesterday with some of the older participants about finding work and being able to be independent and kind of how you can do that when right now, you know, the job market really sucks for everyone. It's tough. And one suggestion that I really have for people with disabilities is you really have to start thinking like outside the box and be flexible and be willing to put yourself out there in different ways. For example, my work with the National Center on Healthcare Transition, I work virtually from my home. So when I'm in the hospital, I'm still able to work as long as I have internet access or, you know, my phone, and people are really understanding about that. I also do a lot of consulting stuff, which is kind of me negotiating with other people and being able to work out me giving speeches or coming to conferences, and it is really sort of flexible around what they want me to do. So I encourage young people to really look at your strengths and think about what you can do that is marketable. Because I think in a world where not everybody can work a 9-to-5, and those 9-to-5s are really hard to get, we need to start being creative. And so I encourage you to really connect with people. It's really all about networking. I told our workshop participants yesterday, get business cards, even if they have like just your name and your email, hand them out to people. If you meet someone and they have a really cool job or you really like their attitude, or, you know, just go up to them and say, how do you do, you know, how did you get to do what you do? How can I learn more about that? I'd love to talk about this later. And just really put yourself out there, engage everybody, connect with everybody. And you never know where one opportunity could lead to something more long-term. But in terms of getting assistance, sometimes you just need help, and that's okay. Sometimes you can be working and get a certain level of support and then be able to work more, and that can change. For me, when I was in college, I was receiving assistance, and then when I was working, I went through the process to change that. But some of my insurance is still through a state program. So it's okay also to recognize when you need that help, and it doesn't mean that you failed, and it doesn't mean that you're not transitioning. It just means that that's where you're at right now, you know. And I say that to everybody about everything. Whether you move home, whether you lose a job, whether you can't handle school at that time, or end up doing a different kind of program, or, you know, changing something. That is not a failed transition. It's an experience, and we learn and we grow and we reassess. So I think in terms of feeling like college is a waste of time, I really encourage you to think about, you know, like Liz said so amazingly, the experiences that you gained, the friends that you made. You know, my degree is in creative writing, and now I'm going back to school for public health. But transitioning to and from college taught me so much to be able to be independent again. So I don't think anything you do in your life is a waste of time. I think they're all learning experiences, and you just have to keep moving forward. So, but I really, really thank you for that question.
I have a comment on that too. If you have cable and you watch shows like Discovery Health, or channels like Discovery Health and TLC, there's a show called, I think it's The Little Couple, and and the woman on that has, I believe, some sort of skeletal dysplasia, so her bones didn't form correctly, and she is a neonatologist at a major health center in Texas. So that just goes to show what you can do. You know, she went to school, then went to med school, went through residency, went through fellowship, and is now a neonatologist.
And I just want to tell a really quick story, really fast, on that note. During my own transition, I was really having a rough time recently and questioning, you know, what I was doing. And I watched that show, and I know people who work at Texas Children's, and I emailed her about my experience and where I was coming from and how I respected her, and how I felt like a lot of people were kind of watching my transition. And she actually wrote back, and so her and I have kind of been in touch, and it's one of those examples of putting yourself out there, looking to the people that you respect and saying, how did you get there? You know, who supported you? And, you know, now I feel like I kind of have her in my circle of support, which is wild and crazy, but you never know until you put yourself out there.